Libyan citizens are caught in the middle.
What is happening is a struggle for power. That's it. And the people are the ones suffering, and they are the real victims.
Militants have seized Libya's oil terminals and ports for months, demanding a bigger share of revenue. Analysts say this could affect the supply and price of oil worldwide. Some of the militias have connections or are inspired by Al-Qaeda and other terrorist groups. Analysts say the instability in Libya is having a regional impact on North Africa. Weapons and fighters are flowing across borders. David Gartenstein Ross.
So long as you have a country that's fractured and one where a variety of violent non-state actors, including not only jihadist groups but criminal organizations and smugglers, are able to find such a space where they can operate from effectively.
Analysts say nobody knows what will happen next. They predict Libya's central government will continue to be weak, and multiple militant groups will continue to fill that vacuum. Meredith Buell, VOA News, Washington.
Well, more than 100 children were among the 488 migrants rescued by the Italian Navy off the Sicilian coast on Wednesday, as the influx of arrivals continues, spurred by the unrest in Syria and the unstable political situation in Libya. Men from sub-Saharan Africa wearing life jackets entered the San Giorgio naval vessel by the White Dock, relieved to have been rescued from the heavy seas. The children are currently housed on ships still at sea after being plucked from perilous boats. Some of the children are being placed on different boats from their parents as they were brought to safety. And emotional scenes took place on deck as family members found each other once again. European Union parliamentary elections this weekend have prompted an often bitter debate across the region about how to handle the rising tide of migrants from Africa, the Middle East and Asia reaching Europe's shores. For the frontline country of Italy, its naval forces feel they are virtually alone in carrying out the most important search and rescue mission in the history of the European Union. 5 Italian vessels are involved in the mission known as Mare Nostrum, or Our Sea, which has been underway since October 2013, when 366 men, women and children drowned in a shipwreck a mile from the coast of Lampedusa, Italy's southernmost point. The mission's aim is to prevent similar disasters and fight human smuggling, mainly from the shores of the increasingly unstable Libya. So far, the operation has hauled over 43,000 people from the seas. On the bridge of the flagship, the San Giorgio, Captain Aldo Dolfini barks orders to launch a rescue craft to help a small fishing boat in trouble at sea with hundreds of migrants on board. The wind is sweeping down from the north, stronger by the minute.
Unfortunately, the situation is deteriorating. The wind force is increasing. We foresee a worsening of the sea conditions. Our objective is to reach the boat, and if we need to intervene as quickly as possible. We will try to get there before dark, because that's when everything becomes more difficult.
Snipers take up positions on the San Giorgio deck in case there is any trouble from trigger-happy human traffickers. Dolfini is sure if they had not been rescued, they would all have drowned in the high seas. The San Giorgio enters the wet dock carrying 300 Eritrean men, scared and tense. They had to be quickly transferred to another Italian vessel, the frigate Vega. Prime Minister Matteo Renzi's government is pushing for more European Union involvement in Mare Nostrum, both in financial terms and in the form of ships.
We cannot stop Mare Nostrum. It would mean an immediate death sentence for millions of people. There will certainly be an evolution of Mare Nostrum. It could grow or be reduced, but it just can't be stopped at the moment.
Italy wants the rules of governing asylum within the EU, known as the Dublin Regulation, to be made more flexible. Well, we want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa 54, and check out our headlines 24/7 on voaafrica.com. Well, coming up, a robotic needle aimed at saving lives. We'll see how it works in our health segment next.
Like Voice of America on Facebook. VOA on Twitter. Join VOA on our YouTube channel. Like, follow, join VOA.
Well, and joining us now is Africa 54 health correspondent Lino Mudu. What do you have for us today, Lino?
Hello, Vincent. Researchers say treatment for the parasitic illness schistosomiasis is more effective if children have a snack before receiving treatment. The researchers work with students at 12 primary schools in Uganda. In addition to an educational message about the parasite, children at some of the schools were given donuts and mango juice prior to treatment. The children who ate something before getting the medicine had half as many parasite eggs in their stool as those at non-snack schools. The study was conducted by researchers from Makerere University in Kampala and was published in the journal PLOS Medicine. And a tuberculosis survivor in South Africa campaigns for more action against the disease in the country where drug-resistant TB is gaining ground. A city of 750,000 people is located 40 kilometers east of Cape Town. Its residents are enduring a tough situation. There is often no proper sanitation or social services, and the overcrowded living quarters here are contributing to a steady rise in cases of tuberculosis. Kayelitsha also has one of the highest burdens of TB in the country, but 23-year-old Fumeza Tisile has survived the disease.
But I was shocked to know that I have TB, especially when they said that this MTR. I didn't know anything about MTR at the time.
Patients can develop strains of TB known as multi-drug-resistant or MDR, extensively drug-resistant XDR, and totally drug-resistant TDR-TB. Standard treatment for TB usually includes a mix of 4 drugs over a period of 6 months. Drug-resistant TB takes much longer. Nkosanti Mzana has been diagnosed with XDR-TB.
But I had it before, and I had for 3 years. I was taking my medication for 3 years. And I was discharged as cured. But after 2 months, it came back again. And then I don't know how did it happen, but it happens.
He is receiving care at the Lizo Nubanda TB Care Center, a medical facility run by international medical charity Doctors Without Borders in Kayelitsha.
XDR-TB certainly is becoming more of a problem, mainly because we're starting to diagnose it more. TDR-TB is still an unofficial term, so the WHO do not recognize the term officially, but we are seeing TB that is becoming more and more resistant to a lot of the drugs that we have.
Tisile will present a manifesto on drug-resistant TB this week at the World Health Assembly in Geneva.
Well, Geneva, I'm attending the World Health Assembly. Well, hoping to, I'm handing over the TR manifesto, which I called with Dr. Jenny. It demands they are quite clear, like the need for better drugs, better diagnosis, perhaps a vaccine if possible.
According to South Africa's 2012 to 2016 National Strategic Plan for HIV, STIs and TB, South Africa has the 3rd highest level of TB in the world. Approximately 1% of over 50 million people per year develop active TB, and more than 70% of TB patients are co-infected with HIV.
I think people are starting to become more aware of this problem. It's taken a little bit of time for people to understand that it's actually an emerging epidemic, but I think people are starting to sit up now and realize that if we don't do something drastic very soon, then it will become an overwhelming epidemic. The South African government and governments across Africa, I think, have done a lot in terms of tackling the TB epidemic, but now drug-resistant TB is certainly becoming more of a problem.
The World Health Organization estimates that 8.6 million people developed TB in 2012 and 1.3 million died from the disease. According to WHO, as many as 2 million people worldwide may be infected with drug-resistant TB by 2015. And back here in the U.S., researchers are developing a new type of robotic needle designed to remove blood clots in the brain. It hasn't yet been used on people, but in simulated surgery, it's been able to remove